Hello, welcome to Dr. Sam's Anatomy classes. I'm Dr. Azmi Mohsin, Professor of Anatomy. In this lecture, I'll be teaching you some interesting facts of the inside of cranium. One thing I'll be telling you is about the intraneural course of blood vessels, right? And the next I'll be telling you is the intracranial course of cranial nerves, and how the meninges terminate at the foramen, right? So these are all interesting points. I'll be covering them all in this lecture. So stay connected, stay listening. So let's begin. This is a cranium. This is a cranium, right? And here you have is the, let's use the same pen. Here you have is the cerebral cortex. I'm leaving more of space so that I can draw the meninges above. So here you find is the cerebral cortex. Okay, and then cerebral cortex, you know, they are having the line by meninges, remember? So let's draw this, the innermost meninge, so approximated, so T3 with the cerebral cortex, and this meninge, you know, is called the pia mater. This is the pia mater, right? And then you have the next is, you know, the surrounding one. The next one is the Arachnoid matter. Yes, this is arachnoid matter. And don't forget that arachnoid matter is filled with CS, subarachnoid space between arachnoid and pia. This space is filled with CSF. So it's a prototype diagram. Then on the outside, the most peripheral or below to the cranial vault, you find is the dura mater. I'm not drawing it, the tool, you know, splitting it actually, you know, you all know already because this has been taught in detail. This splitting of the two layers that form falx cerebri and everything. So we should not waste time in describing all that. But remember, between the two layers, there's this dural venous sinuses. My purpose telling here is about the blood supply of the cerebral cortex. You know that the cerebral vessels, they run in the subarachnoid space. So just imagine that there are blood vessels running here in the subarachnoid space, right? So this considered to be a blood vessel running here in the subarachnoid space. And let's draw a cortex. Here, this you find is the cerebral cortex, and down below you'll find is the white matter. The surrounding here, it is the cerebral cortex. Okay, now about the blood supply. So these cerebral vessels, they're running here, and one more important thing which is left out is that these blood vessels, you know, this is a trabeculated space. You also know that this arachnoid matter is trabeculated, you know, this spongy layer. The subarachnoid space is filled with trabeculations. This trabeculations also providing space between, you know, for the blood vessels to run there. And the pia mater, I think there's less of space, but still, if you try to understand, these cerebral vessels, they will give out their, you know, cortical branches, these small branches supplying the cerebral cortex. But few of these few branches from the cerebral cortex or from the cerebral arteries, they reach down into the white matter, and these are the central arteries. So the central arteries, like I'm not writing it everything so that it becomes crooked, although, but this needs some importance, so let me write it down. I think this is the central artery. Central artery is actually a branch from the cerebral arteries which goes deep inside and perfuses the white matter. So this supplies the white matter, and of course the basal nuclei, the nuclei present in the white matter, that also being perfused by this. Now, because this is running on the pia mater, and one more thing is these vessels, they are actually tethered to this, in the subarachnoid space. The vessels, they run on the pia mater. So the pia mater here also is splits into two layers. The pia mater splits into two layers so as to grip these vessels, right? So the pias running over the vessels is called epipia. I should not write it here. There's less of space. Why not write it here? So this is called epipia. Epipia is the layer of the pia, superficial layer of the pia, which covers and blends with the blood vessels so as to grip those vessels on the cerebral cortex. And while the deeper layer of this pia mater, which is tethered, to the cerebral cortex, and that is called pia glia. This is called pia glia. This is called pia glia. So in between these two blood, the layers of the pia you find is the cerebral vessels. Now think about when they'll give these cerebral branches, the central arteries, they will either have to pierce the pia to reach down into this white matter, or one thing that they do is they can wear the pia along their course. This can be this is actually what is happening. So these central blood vessels, when they reach down deep into the medulla, or you can say the white matter of the cerebral cortex, they wear the pia mater as a sheath around them, and this sheath is actually called the perivascular sheath. This is called perivascular sheath, right? And this has a special name, if you can remember, because of the name of the scientist. This is called Virchow Robbins. Virchow Robbins space. The perivascular space is also called the Virchow Robbins space. Okay, so this funda is clear now. And now about the amount of vasculature. The cerebral cortex has enough blood supply. This portion has enough blood supply because the several minute branches perfusing the cerebral cortex, and these are also having collaterals and anastomosis. So there is a rich blood supply in the gray matter. Unlike the white matter, look here, I'm not writing everything because you are listening as well. So you listen, keep listening, keep writing down notes, or you can take the screenshots if you want to make them protected. Otherwise, you can rewind the video and watch it again. So these are the minute blood vessels which perfuse this gray matter, and they're well collateral branches. They're having collateral and they have enough of anastomosis. So that means the gray matter is richly perfused. Now about the white matter, these central branches. Remember that these central branches, these are end arteries. These are end arteries, right? So that means they don't have any collaterals. So in case if there is any blockage or thrombosis, a rupture of this vessel and because of hemorrhage, so what happens that the area being perfused by the central artery, that undergoes initially irreversible and later on irreversible changes. And that might be in the form of paralysis, maybe it's a sensory area, then loss of memory and loss of visual sensations, whichever the part of the cortex it is involved. When similar, like you will have a sensory and motor loss. So because it's an end artery, remember. Okay, so that was about the blood supply and related microscopic and anatomy of this cerebral cortex. Now think about the other thing, that is the I'm talking about is the cranial nerves. So the cranial nerves, they all arise from the brain. First and second arise from the forebrain. The remaining 10 nerves, they arise from the brain stem. Anyway, so let's imagine like there is this, it's all an imaginary, it's a prototype diagram. There is this a foramen in the skull, right? So cranial nerves, they are arising. Let's say it is arising from this brain in the form like these cerebral nerves, they also will be running in the subarachnoid space, and that's how it will emerge out of the cranium. So it's this nerve, cranial nerve. So now think again the reason which I told you here, because the gray matter is inside the pia mater. So when the nerve will emerge, obviously it will have two options, either to pierce the pia mater and then emerge out, or it might wear the pia mater along its course. So that's what is happening again here, that this nerve, when it emerges from the gray matter, it wears the pia mater. Now the space is becoming less. So I think you can consider it here that this is, I have to make it a bigger size. Let's say this is the cortex, cerebral cortex, and this is the gray matter surrounding. And this nerve, cranial nerve, is arising from here like this. This is the cranial nerve. And presume that it is emerging out of this foramen, right? And this is the wall of the skull. And I just taught you that there is this pia mater surrounding the gray matter. What I am teaching you is all zooming this thing. This has been zoom out here. Okay, so this pia mater will also cover this nerve within the cranium like this. Okay, now what about its extracranial course? So as you know that when a nerve becomes a peripheral nerve after emerging like out of the cranium now, or rather even just emerging out of the CNS, this nerve is called a peripheral nerve. Cranial nerves are also peripheral nerves. So now what happens, the outermost layer of a peripheral nerve is called epineurium. So this pia mater will merge with the epineurium. This will merge with the epineurium. So these are small little things. You should remember how it's all going. Now this is pia mater, but here it will become a part of epineurium. Okay. Then outside to this, as I told you, was this arachnoid matter, right? So this is arachnoid matter. Now below to arachnoid and between pia there is this CSF. This also I told you. So the intracranial portion of these cranial nerves, especially if you remember the three, pure sensory nerve, first, second, and eighth. Oh, sorry, first, second, and eighth. So all these are pure sensory nerves, and they are full layer of sheaths, these meninges surrounding them, and there is CSF covering from all these three cranial nerves. But for the rest of the nerves, the intracranial portion, they have this covering of meninges, but as they reach towards the foramina, these nerves, they stay inside while these nerves emerge out. So the meninges, how do they terminate here at this foramen? That's what I'm telling. Pia mater you're seeing is continuing with the nerve in the form of epineurium. It merges there and becomes an epineurium. Now about the CSF. So remember that the peripheral nerves, they have on their surrounding, they have these peripheral lymphatics. This is called peripheral. There's less of space, so you can understand what I'm talking. Peripheral lymphatics. Got it? So this is peripheral lymphatics. So CSF drains into the peripheral lymphatics outside the cranium. So this is one mode of drainage of CSF. Remember that 90 to 95% CSF drains via the arachnoid villi and granulations, and mainly into the superior sagittal sinus. Right, and you know that lymph actually, lymph in the body is same as nearly to the CSF. The CSF replaces the lymph in the cranium and within the surrounding the CNS, even in this vertebral canal. So what is that ultimately the CSF within the cranium was 90% draining back into the dural venous sinuses. But 5 to 10% of the CSF also drains along with this nerves and merges with this, perineural lymphatics. So that's this end of CSF here. And this, this arachnoid matter will also merge with the covering connective tissue there, blend with the connective tissue. Now what rest remains is the dura matter. Right, the dura matter surrounding this nerve will also reach to this intracranial portion of the nerve, and this dura matter will now merge with the periosteum of the bone inside, and that's called endocranium. And in fact, if you remember, endocranium was itself a layer of dura matter. Dura matter has two layers. One has an endosteal layer, another is the meningeal layer, where you have dural venous sinuses. Otherwise, it's a single layer. So this dura matter will merge with the endoneurium. Or endosteum is the better word, not endoneurium, sorry. This is endosteum. Endosteum is the periosteum on the inside of the cranial vault. So or rather the entire cranium, the inner layer of this periosteum is called endosteum. So that's how the dura matter merges. So you have now ultimately got to know about important thing is like how the blood vessels perfuse the cerebrum, and what about the meninges, and how the nerves emerge out from the cranium, and what about the meninges. Got it? So it's done.